Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show. I hope you've had a great week and a great weekend that just went by. This is going to be an incredible show. This is all going to be about how to eat, how to eat. That's funny. How to beat blood and bleeding disorders. This happens to be March of 2024, and the CDC wants you to know this is March. And March on the 12-month calendar is Blood Disorder Awareness Month. All right, so I have an entire presentation of everything you need to know about beating blood disorders all naturally. That's what's coming up. So anybody you know that has anemia or any other kind of weird sickle cell anemia, kind of bleeding disorder, this show is for them. I'm going to show you all the stuff that's published on cures for those things and how to prevent them, slow down its progression, or reverse it altogether. So that's going to be very exciting. I hope you guys are ready for it because it's going to come up right after this commercial break. Don't go anywhere. I don't do this stuff for nothing. All right, we'll see you in a minute. All right, everybody. Welcome back to the Dr. Ardis Show. I'm your host, Dr. Brian Ardis, and this show is all about blood and bleeding disorders. Why? Because you don't need them. And just so you know, you probably don't need MDs either to drug you for your bleeding disorder or blood disorder, no matter what they've told you. Even if they told you it's a genetic thing. I'm going to actually take you through what is published as natural cures for all bleeding disorders and blood disorders, like anemia, sickle cell anemia. It's going to be great. All right, so who's bringing this show to you? I am. healingfortheages.com. If you missed our virtual conference just last weekend, I'm sorry. Go back to Healing for the Ages and go watch it. All right. So healingfortheages.com. This is a conference I created in September. Go subscribe to the newsletter. And if you haven't watched the presentations from last September, go download them all. You need them to be ready for our September coming up, Healing for the Ages 2.0 conference. All right, good. Outside of that, Hydro Shot. Go to h2bev.com. Put in the discount code DOCTOR, and you'll save 10% off of your Hydro Shot drinks. I drink them every day, sometimes twice a day. Gives me 8 hours of energy with nitric oxide infused with hydrogen. It's an amazing product. I love it. I've been using it for years. Thank you, Kurt Rutman and Hydro Shot. Y'all did a great job. Go to h2bev.com to learn more. You want a discount on it? Put in my last name, ARDIS, or the word doctor. Either one of those should generate the discount for you, which is great. MyPillow.com, put in the promo code DOCTOR. You can actually get discounts and additional discounts on anything at MyPillow.com or at his new MyStore.com also. Also want to let you know that this is going to be brought to you by my Cardio Flow product at the Dr. Ardis Show. And you're about to learn why, right? Cardio, heart, cardio, flow. Flow is the blood flow going through the body. This is a blood disorders presentation. All right, let's get into it. As you know, this presentation has the video. At the drardisshow.com under patient resources is the entire PDF that includes every slide from this presentation I'm about to show you if you're watching this. If you're driving, listening, wherever, at your leisure, just make sure if you need information, you feel like you need to pull over and take a note or you need to write it down, you don't. It's all at the Dr. Ardis Show for free underneath patient resources. Click it and then send it to anybody you know who has blood disorders. Maybe they need this info. You should see it on screen. Blood/bleeding disorders 101. All right, March is Bleeding Disorders Awareness Month. Just want to make sure you know this is what the CDC, the NIH, HHS, FDA, all of them want you to know. It is Bleeding Disorders Awareness Month. All right, so let's set some expectations here. What are blood disorders? Blood disorders are conditions that keep parts of your blood from doing their jobs. For example, your red blood cells carry oxygen throughout their body. So if there's a problem with the red blood cells carrying oxygen throughout your body, you have a blood disorder. Your white blood cells help protect your body from infection. So if there's a problem with the white blood cells, picture leukemia or something like that, that is a blood disorder. Your platelets help your body to clot so you don't bleed more than normal. So if you have a problem with clotting, overclotting, not clotting, blood's too thin, that's a platelet blood disorder. All right. What are common bleeding disorders? Bleeding disorders happen when your blood doesn't clot normally, causing you to bleed more than usual. Bleeding disorders include Van Willebrand disease. For those of you who don't know what that is, there's the definition. It's a condition. This condition is the most common bleeding disorder in the United States. And most people who have von Willebrand disease inherited a mutated gene from one of their biological parents. And some of these people have complications of cancers, autoimmune disease, and heart and blood vessel diseases. I hope all those individuals are fans of the Dr. Ardis Show because we can teach you how to manage that stuff. Also, inherited hemophilia. This rare genetic condition may make you bleed more than usual. Thrombocytopenia, which is a huge problem with COVID, and after getting vaccinated. Thrombocytopenia. This condition happens when you have a low platelet count, immune thrombocytopenia, the immune system doing it, and thrombotic blood clotting, thrombocytopenia purpura, are examples of diseases that cause thrombocytopenia. Another blood disorder is fibrinogen deficiency conditions. Fibrinogen is required to make blood clots. So fibrinogen is another protein that helps your blood clot. If you don't have enough of it or the fibrinogen doesn't work as it should, you may have abnormal bleeding or clotting issues. What are common disorders of blood clotting conditions? Prothrombin gene mutation, antiphospholipid syndrome, protein S deficiency, protein C deficiency, antithrombin deficiency, not able to make a clot, paroxysomal nocturnal hemoglobinuria. Who knows what that means other than it happens at night? Isn't that funny? And then disseminated intravascular coagulation. These are micro little blood clots throughout the body that led to all your COVID toes, COVID fingers scenario where your fingers and toes turn black and then you have to cut them off. Little bitty blood vessels are full of blood clots and those tissues die. Now, if any of y'all know anybody who has these conditions, which I do not personally, but if somebody you know has these conditions, this show is for them. So please share this with them. All right, common bleeding disorders, symptoms. This is how you would know you possibly have a blood clotting disorder. Number 1, nosebleeds. Number 2, excessive bleeding. Number 3, internal bleeding. Bruises, bruising that happens for no apparent reason. You know, all these people with Coumadin and blood thinners who have all this bruising all over the body, you have a bleeding disorder. Heavy periods, menstrual bleeding, heavy bleeding after childbirth or miscarriage, blood in your poop or stool. If you see black blood in your stool, you have a high, way up high in your digestive tract, you have a bleed. If it's red, it's closer to your anus. Blood in your urine. Talk to your doctor if you have blood in your urine. These are all signs that you have a bleeding disorder. To kick off the relevance in the media, I wanted you guys to know that they are talking right now in the last 3 or 4 months about a new world's first gene therapy for 2 blood disorders, sickle cell anemia and thalassemia, has been approved. Casgevy, the first medicine licensed using the gene editing tool CRISPR. All right, so all of you, CRISP, CRISP, stands for cysteine-rich secretory proteins that come from snake venom. So they are using more snake venom now to tell you should use snake venom gene editing therapy. Venom cleaves to and cuts RNA, DNA. They're now making COVID type mRNA gene therapy vaccines and drugs for sickle cell and thalassemia. Everything's going to go to CRISPR and new gene therapy. All right, NBC News says a new gene therapy could be a game changer for patients with severe anemia. Anemia is low iron in the blood. The cost is $2.8 million. How many of you could afford $2.8 million for a drug to help you with your anemia? We're going to teach you about anemia. Just so you know, anemia, number 1 caused by copper deficiency. You do not need a drug that costs $2.8 billion or $2.8 million. You just need copper that might cost you $50 a month, and you're going to be fine. So ridiculous. All right, so that's in the news right now. The World Health Organization is calling for, this is last year, the World Health Organization is calling for accelerated action to reduce anemia, low iron. Let's read the blue highlighted parts. Anemia is a serious global public health problem affecting 571 million women and 269 million young children worldwide. All right, get that number. 571 million plus 269 million is almost a billion people. That's almost 15 to 17% of the entire world's population have anemia, low iron. They all have one thing in common. They're deficient in copper. All right, in 2019, anemia affected 40% of children between 6 months and 5 years of age because their mom's deficient in copper and eating glyphosate in their processed food. 37% of pregnant women and 30% of women 15 to 49 of age. It is most prevalent in low and middle income countries. Anemia increases the risk of infections and death, impairs cognitive performance, that's all lack of copper, and causes extreme fatigue because copper makes ATP. Poor pregnancy outcomes, that's awful. Loss of earnings and poor growth and development. It's a strong indicator of overall health. Now, what are they using to treat this stuff? All right, let's show you the first drug they're using to treat blood disorders. First drug we're going to talk about is warfarin. All of y'all have probably heard of warfarin. Let's go over some of its side effects. Let's look at their mild and serious side effects. Mild's on the left of the screen. Minor bleeding or bruising, nausea and vomiting, diarrhea, gas and bloating, taste changes. Oh, don't you remember that during COVID? Taste changes, chills, itchy skin. Serious warfarin side effects include severe bleeding, tissue death. That means cells in your body are going to die from warfarin. All right. Severe bleeding, tissue death. That means muscle, skin, ligaments, tendons will die if you swallow warfarin. Calciphylaxis, calcium deposits in your blood vessel. Oh my God. Haven't you heard of like these Doppler carotid arteries in your neck scans they do to see if your arteries are calcifying? Did you all know that warfarin does that? I didn't until I was preparing this actual presentation. All right. So, all of you that have Dopplers done, all of you who are having calcium test run on ultrasound on your neck, and they say you have calcium in your blood or in your blood vessels, that is a side effect of warfarin. You need to get off of that. And if they tell you need warfarin, that actually causes it. Kidney damage or failure is another published serious side effect of warfarin. Vasculitis is inflamed blood vessels, and hair loss. Not sure many men or women want to have hair loss due to warfarin, but just so you know, losing your hair means you've been poisoned. Remember, when people go through chemotherapy, what happens? One of the very first things, all their hair falls out. Hair falling out is a symptom of being poisoned. Warfarin is poison. All right. The next drug that they use primarily for blood disorders is heparin. Heparin may cause you to bleed more easily, they say, which can be severe or life-threatening. Oh my God, why would you use this for a bleeding disorder if heparin causes you to bleed more easily? So ridiculous. All right, this is off of drugs.com. Did you know heparin causes you to have a more life-threatening bleeding episode? Oh my gosh. All right. You might see discoloration in your skin, they write. Irregular heartbeats and chest pain from heparin. Heparin also causes shortness of breath, dizziness. Who doesn't want to be more dizzy? Anxiety, sweating, any unusual bleeding. Report to your doctor if you have severe pain or swelling in your stomach, lower back, or groin. Everybody wants groin pain from the drug they're swallowing or injecting. Dark or blue-colored skin on your hands or feet. That means you have cyanide gas in your body. You are dying. Just so you know. Nausea, vomiting, loss of appetite, unusual tiredness, any bleeding that will not stop is a side effect of heparin. Nosebleed, blood in your urine or stools, black or tarry stools, coughing up blood or vomiting that looks like coffee grounds. Side effect of heparin. Heparin can cause you to have bleeding episodes while you're using it and for several weeks after you stop using it. So even if you stop it, people, and you're still bleeding, just know it takes several weeks for this crap to get out of your body. Bleeding may be more likely in older adults. Are you listening, older adults? Especially women over 60 years of age. Stop using this medicine and call your doctor at once. If your skin changes where the medicine was injected, fever, chills, runny nose, or watery eyes happen, easy bruising, unusual bleeding, purple or red spots under your skin, signs of a blood clot, call your doctor immediately because heparin can cause blood clots. Sudden numbness or weakness in your body, problems with vision or speech, swelling or redness in an arm or leg are all signs you have a blood clot, and heparin can do that to you. Common heparin side effects also include bleeding or bruising, uncontrolled bleeding, allergic reactions, or abnormal liver function tests. That means liver toxicity. Ask your doctor if liver toxicity, dizziness, death is right for you. Desmopressin acetate tablets is the next drug they use for blood disorders. Side effects that you should report to your doctor immediately include breathing problems. The drug, again, is called desmopressin. Breathing problems, chest pain and tightness, changes in your blood pressure, irregular heartbeat, flushing of your skin, headache, drowsiness, dizziness, confusion, vomiting, muscle cramps, restlessness, seizures. Oh my God, did y'all know that causes seizures? Sudden weight gain, swelling of the legs or ankles, unusual weak or tired, dry mouth, headaches, mild nausea. Sounds great. The next drug we want to make you aware of is Hemlibra. Hemlibra is another blood disorder drug that are often prescribed. Did you know this serious side effects of this drug called Hemlibra, hem meaning blood in Latin, hem. These serious, or maybe him means iron, actually. Sorry, I might have screwed that up. All right. These serious side effects include thrombotic blood clotting, microangiopathy. Angiopathy. Y'all know what that means? Micro blood clotting. It's a condition involving blood clots and injury to small blood vessels that may cause harm to your kidneys, brain, and other organs. Okay, that's a side effect of Hemlibra. Also, they published that this blood disorder drug also causes blood clots that lead to strokes, which may form in blood vessels in your arm, legs, lung, or head to cause a stroke. Call your doctor at once if you're experiencing while on Hemlibra stomach, chest pain, confusion, weakness, nausea, vomiting, swelling, pain or redness, feeling sick or faint, decreased urination, can't pee, yellowing or yellowing of skin and eyes. That's jaundice, liver failure. Let your doctor know if Hemlibra while you're on it is creating eye pain, swelling or trouble seeing, fast heart rate, numbness in your face, headache, shortness of breath, coughing up blood. All right. Let's talk about inherited anemias. This slide may be out of order, but there are inherited anemias. Anemia means lack of iron. So let's talk about these blood disorders related to anemias. That include sickle cell anemia, Fanconi or Fanconi anemia, diamond black fan anemia, and thalassemia. So you can read those. They're on the screen. Thalassemia is pretty common. In thalassemia, your body produces less hemoglobin, resulting in small red blood cells, and they can't hold iron. Iron carries oxygen to your tissues. What are other examples of anemias? You have hemolytic anemia. In this anemia, your red blood cells break down or die faster than usual. Sideroblastic anemia, I've never even heard of this till this presentation, results from abnormal iron use during red blood cell development in your bone marrow. Microcytic anemia, this is anemia that happens when your red blood cells don't have enough hemoglobin, so they're smaller than usual. All right, here's the next drug they use in blood disorders. It's called ribloxil. Ribloxil, here's your warnings and precautions. Thrombosis and thromboembolism. In patients with thalassemia, thromboembolic events were reported. Just so you know, high blood pressure, embryo fetal toxicity. Just so you know, if a woman is given this drug, the baby will die. So if a baby will die, you're going to die. Don't take it. Adverse effects of this drug also include issues with all kinds of things. All right, you can see it on the screen, all the stuff that's written about it. Epigen is the next blood disorder drug I want to share with you. Epigen, or epoetin alpha. All right, so epoetin alpha side effects. ESA increases the risk of death. Oh my God, did you read the first statements on drugs.com about epoetin alpha, which is a drug given to people with blood disorders? These drugs increase the risk of death. Myocardial infarction is increased. Stroke, venous thrombolytic thrombosis of vascular access and tumor progression, or reoccurring chronic kidney disease is what occurred in clinical trials using this drug. Patients experienced greater risks of death, I'm quoting, from epoetin alpha drug being given to them. Can you believe this is still FDA approved to give to people with blood disorders? This is how disgusting this whole scenario is. So ridiculous. All right, so I just want to read that to you. And this drug is called epoetin alpha, or epoetin, as you see is the brand name. All right, serious side effects of epoetin, as if death, myocardial infarction, seizure, strokes aren't enough. Call your doctor immediately if you have any of these symptoms while on epoetin. Black tarry stools, blurred vision, body aches, bone pain, chest pain, chills, cough, dizziness, dry mouth, ear congestion, sore ulcers, sore throat, sneezing, slow or fast heartbeat, runny or stuffy nose, pounding in your ears, nervousness, painful or difficulty urination. Everybody wants to have a more difficult time peeing, don't you? Also, call your doctor at once if you're on epoetin alpha for a blood disorder and you experience a fever, flushed dry skin, fruit-like breath odor. That means you're now getting diabetes from the drug. Headache, increased hunger, increased thirst, more diabetes symptoms, increased urination, more diabetes symptoms, itching, skin rash, loss of voice, nausea, vomiting, unusual tiredness or weakness, unusual bleeding, unexplained weight loss, trouble breathing, tenderness, pain, swelling, warmth, swollen glands, and stomach pain are just some of the serious side effects you have to call your doctor about once you start taking epoetin alpha. But please don't forget, it actually states the very first warning on drugs.com that if your MD doesn't tell you, you should slap them and fire them and file a complaint. If they tell you you need epoetin alpha and write that prescription, and they do not tell you out loud out of their mouth that this drug increases your risk of death, you should be extremely angry, as I would be. More serious side effects that are less common is anxiety, decreased urine, difficulty swallowing, and fainting. Do y'all see fainting? Yeah, fainting's crazy. All right, so what we're going to do is we're going to get on the opposite side of the break here in just a minute. We're actually going to dive into what are the natural solutions that are public and published as cures to all bleeding disorders. All right, so we are going to be back here in just a few minutes. I want to actually share with you for the last minute of this episode. If you're not a part of the Ardis Club membership, you should consider going to the drardisshow.com, signing up for the Ardis Club membership. I'm going to be diving into natural solutions here of blood disorders. All of these are peer-reviewed, published articles, and a lot of these products actually come from my website. There's reasons why I formulated and picked specific ingredients in products I started making 5 years ago. And that was to help with conditions like this. So I created formulations that had ingredients that are proven to affect and improve many, many states of health. The Ardis Club membership is a monthly subscription model. Pay $19 a month, or you can pay $20 a month Sorry, $19.99. Or you can pay an annual subscription and get 2 months free. What happens when you do that is you get our presentations 3 days before anybody else does. So you will receive it into your special backend account on the drardisshow.com just for members. You will get my PowerPoint presentations, my actual video presentations, and any interviews I do. They come to you first 3 days before the rest of the world gets it on every Wednesday. So that's a great place to go. That's not the only benefit. You actually get discounts on all of our products. In addition, just being an Ardis Club member. It's like a Costco membership, Sam's Club membership. You get discounts. So we're going to be back after this commercial break, and we're going to get into blood disorders, naturals, solutions. All right, everybody, welcome back from the break. I'm Dr. Ardis. This is the Dr. Ardis Show. Let's continue our bleeding and blood disorders 101 presentation because supposedly March is blood disorders. So we've introduced you to what blood disorders are, what the types are, the most primary, most common ones. We introduce you to that medically, then we introduce you to the most common drugs being prescribed around the world and to all your friends and family and yourselves if you have a bleeding disorder, what medical drugs they're giving you and what their side effects are. All right, so my mission is to create doubt in big pharma and restore your faith in nature. Why? Because drugs need to be used in a very limited form in a very short span for an acute issue, and you need to let all the other reasons go. Life in the body requires air, water, food, not air, water, food, drugs, and vaccines. So that is not how it works. All right, so my goal is to try to get you off as much drugs as possible because they're all poisons, toxins. They are not natural, and your body is a natural substance that God created, and he put everything on earth that was natural before he put you down here. And I'm trying to convince all of you that you got it right the first time. So that's the purpose of these shows. All right, so we're going to continue into our program. This is being brought to you by KirkElliottPhD.com. If you haven't secured gold and silver, if you haven't taken care of your assets and actually taken a consultation with a financial advisor, why not do it with Kirk Elliott? He's got 2 PhDs in economics and in theology. He knows what the mindsets are of these globalists that control our economy, and you've been working your whole life. Don't let them take it from you, what you've earned and saved and all your assets. Kirk Elliott PhD is there to help consult you, just like he has me and my wife and my family. All right, also GrowMaxWaterHydro.com and also the drardisshow.com. All right, so let's dive in. All right, so we're going to continue. We're now into the natural solutions of blood disorders. I showed you all the types that there are, that they say there are. So I've got 20 minutes to get you through the most powerful natural solutions for blood disorders. All right, so on the screen, you're going to see turmeric. Turmeric, otherwise known as curcumin, most often. People have long used turmeric for culinary and medicinal purposes, as you read on the screen from Medical News Today. Curcumin is an active ingredient in turmeric and appears to have anti-inflammatory and blood-thinning or anticoagulant properties. Did your medical doctor who's got you on Coumadin, warfarin, or heparin or telling you to take those things, did they actually give you the option that turmeric is proven to do that? Did you know ginger root, ginger tea, ginger ale, you name it. Did you know ginger is proven to actually have anti-inflammatory spice that helps prevent blood clotting? Did y'all know that? Did you know vitamin E reduces blood clotting? Did you know the National Institutes of Health and their Office of Dietary Supplements suggest that people taking blood-thinning drugs should avoid large doses of vitamin E? Do you know why? If you took vitamin E, you wouldn't need their drugs because vitamin E thins the blood. You'll see there's a dose there. There's over 400 international units per day to have a blood-thinning effect is what they find. I would use vitamin E all day before I would use Coumadin ever. Garlic should be a staple in your diet. Garlic. 2018 rodent study found in mice. They study mice because mice have every genetic makeup humans do. So if it happens to a mouse, it happens to you. So in this study in 2018, they decided to see if in a mouse and in a human, they found that evidence of the anti-thrombotic or anti-blood clotting activity in garlic, which means it may help prevent blood clots. 2020, they did a study and found that garlic supplements help reduce blood pressure and had mild anti-blood clotting effects in people with high blood pressure. Cassia cinnamon. Cinnamon. This is the most common form of cinnamon that we buy in America to add to food, baked goods, you name it. Cinnamon contains a substance called coumarin that I've been educating people on. It's found in cinnamon and inside of tonka beans. And this was what they used to make warfarin, known as coumarin, as Coumadin. So warfarin, the generic name is Coumadin. You'll read here, cinnamon contains coumarin, a blood-thinning agent. Warfarin, a commonly used blood-thinning drug, is derived from coumarin. Coumarin, if you want to just isolate coumarin and make it a patented drug, they called it Coumadin. Aloe vera, like ginger and cayenne pepper, aloe contains salicylates, which may help blood thinning effects. Now, I'm going to show you a study from aloe because I had to go look this up. I had never heard that aloe could help with blood clotting, but this was miraculous. All right, so I had to go look this up and learn more about this. All right, so comparison of effects of aloe vera gel with aspirin and celecoxib on platelet aggregation. Platelets, when those attach to each other, that creates a blood clot. Y'all remember that from the beginning of the show. All right, so aloe vera gel, what did they find? This study has demonstrated a dose-dependent platelet effect of aloe vera gel, which is comparative to aspirin. Did y'all know that when they use aspirin and prescribed everybody a baby aspirin to keep their blood thin, to keep them from blood clotting, did y'all know, and has anyone ever told you that aloe vera is just as good as aspirin? And why hasn't anybody told you to drink aloe vera juice or aloe vera gel or to swallow a capsule full of aloe, which is all natural and not a drug made by Bayer, the corporation who literally funded drug experiments on Jewish people in concentration camps during war-torn Germany in World War II? Why are you supporting Bayer aspirin to thin your blood when aloe vera does it itself? And why would you give money to Bayer anyway? Bayer owns Monsanto. Monsanto produces and owns glyphosate. Now Bayer owns them, and they are poisoning all of us. Okay. Their conclusion in the aloe study for blood clotting. This in the lab study has established a significant dose-dependent anti-platelet effect of aloe vera gel, which is comparable with aspirin at high doses. Isn't that amazing? So aloe vera at a high dose. Now I'm going to show you what the high dose is because I thought this was important. Okay, so they compared aspirin and aloe, and they said aspirin was just below how effective it was at clearing blood clots. Aloe vera was just below aspirin in its efficacy. So I want to show y'all what they said. I looked this up to find out, has anyone ever determined a lethal dose of aloe vera? I've never known this. Well, I found this study, so it's on the screen. The lethal dose of aloe vera in Swiss albino mice was 120 milligrams for every kilogram of body weight. Now, the LD50 you see on the screen, lethal dose, they represent that in parentheses, LD50 in blue, you see it on the screen. The lethal dose of aloe, LD50, in Swiss albino mice was 120 milligrams per kilogram. All right, the lethal dose, just so you know, when you read research studies, LD50 means this is the dose that killed half of the study group. So if they had 100 mice in this study, the dose that killed half of them, at least half of them, was 120 milligrams per kilogram. All right, so for all of you wondering how much is that in a male or human, 200-pound person, that means a lethal dose would be 10,000 milligrams per day. I did the math. You know what else that means? That also means if you took, for example, Global Healing's aloe vera gel capsules, every gel caps has 180 milligrams of aloe, all organic, natural aloe. You would have to swallow 60 of those capsules every single day to even get close to the amount that is lethal. Now, just so you know, Global Healing sells a month's supply of aloe in capsules, and it's 60 capsules, 2 per day. You would have to swallow that whole bottle every single day for weeks to even get close to the lethal dose of aloe vera that they found affected half of the animals they gave it to. So just so you know. Did you know melatonin regulates circadian rhythms, like your body's clock, and that it can be used to block the clumping of platelets to form clots in a 2020 study? How about that? Here's the actual study. Down below, you will read, this is titled Diabetes and Atherosclerosis, blood clots in your arteries. All right, the anti-inflammatory, anti-hypertensive, antioxidant, and antithrombotic, anti-blood clotting activities of melatonin make it a potential therapeutic agent to reduce the risk of vascular occlusive or blood clots disease in diabetes. The mechanism behind melatonin-associated reduction in procoagulant or blood clotting response are not fully known. However, I highlighted this next sentence. Current evidence suggests that melatonin blocks platelet aggregation and might affect the coagulation cascade, altering fibrin clot structure. That's what causes blood clotting, and or resistance to fibrinogen. What causes your blood clots? Did y'all know melatonin does that? A cardioprotective and antithrombotic effect, blood clotting effect, protective effect of melatonin might also stem from a selective effect on the plasma levels of coagulation or blood clotting measures, including things called fibrinogen FV3, both of which are found at increased concentrations in diabetics and are associated with an elevated risk of coronary thrombotic events. All right, blood clotting and strokes. Melatonin helps reverse that. The atheroprotective potential, the blood vessel protective potential of melatonin comes from evidence of melatonin deficiency increasing. So, not enough melatonin increases the risk of cardiovascular events by augmenting sympathetic activity, nervous system activity, which then contributes to platelet activation and hypertension induced injury to the inside layers of your blood vessels. So if you don't have enough melatonin, you'll develop blood clots and have damage inside of your arteries where plaquing will build up. All right. Did you know that copper deficiency, read the top of the article, copper deficiency, a new triad, which if you don't have enough copper in your body, it will lead to a new triad of three things wrong with you: anemia, leukopenia, which is low white blood cell count, and myeloneuropathy, muscle and nerve pain all over the body. Let's read the first sentence here. Copper. Clinical copper deficiency is now more frequently recognized. Hematologically, it can present as anemia, microcytic, normocytic, or macrocytic, and neutropenia, low white blood cells. They're going to give you an example here of a case study. There was a lady who had a copper level was undetectable at less than 5 nanograms per deciliter of blood. She was given intravenous, followed by oral copper supplements. Within 4 to 6 weeks of copper replacement, her macrocytic anemia, her iron deficiency, and leukopenia, white blood cell deficiency, resolved completely. Isn't that amazing? So iron levels improved when they supplemented copper. Isn't that funny? I find it amazing. So copper and iron can't be in the same place. When you don't have enough copper in your body, iron, it gets inside your cells of your organs and creates disease. When you start supplementing copper, the iron comes out of the cells because copper goes inside the cell to be used to make energy called ATP in your cells. If iron's in there, copper can't get in there. If you're copper deficient, iron just goes in there. If you supplement copper, iron comes back out into your blood, reversing your anemias of all types. And they just proved it here in 4 to 6 weeks. They could reverse it all. All right, so that was great. And then they publish here that in table 2 shows her laboratory values after copper supplementation. Her neurological symptoms started to go away in 5 to 6 months after copper supplementation, but did not resolve completely, but they improved. On subsequent outpatient visits over a year, her weight remained stable and she reported only mild generalized weakness neurologically. Isn't that amazing? Just copper. Now, just so y'all know, we just added copper to our website at thedrardisshow.com. I am now carrying and selling bioactive copper, and you can get it at thedrardisshow.com. If you're an Artist Club member, you get a discount. It is a very expensive supplement. You only need one a day, typically. If I do one-on-one consultations, I can actually adjust that and tell you to take more or less, but the recommendation is one a day. And everybody should be taking copper. You're all deficient. Glyphosate they're using all over the world destroys copper reserves in the soil, and it's leading to a chronically fatigued, diseased society. All right, now this is EDTA. All of you know about my EDTA probably at our website at thedrardisshow.com. EDTA is a heavy metal detoxer. It removes it from your body. It also destroys snake venom, which is why I'm telling everybody in the world to use this thing. They've gotten the COVID-19 shots or long hauler symptoms. Y'all have venom. Historically, they write in this article called The Role of EDTA in Anticoagulant Purposes, Stopping Blood Clotting. Historically, EDTA has been recommended as the anticoagulant of choice. Wow, I didn't know that. Did you know that? It is the blood clotting busting drug of choice for hematological testing because it allows the best preservation of cellular components and morphology of blood cells. The remarkable expansion in laboratory test volume and complexity over recent decades has amplified the potential spectrum of applications for this anticoagulant called EDTA, which can be used to stabilize blood for a variety of traditional and innovative tests. Ask your doctor if EDTA is right for you if you have blood clotting. Has anybody ever told you that? Well, I'll tell you that. You don't need warfarin, heparin, and Coumadin only. You actually can use vitamin E. You can use green leafy vegetables. You can use EDTA. I mean, These are great. You can use turmeric. You can use all kinds of stuff. All right, now these are the top cinnamon health benefits, and I want to show you the anticoagulation highlighted section on the screen. One of cinnamon's components, called coumarin, is an anticoagulant. Did y'all get that? An anticoagulant. These agents prevent blood clots from forming, according to the American Heart Association. Talk to your doctor if you're taking blood thinners and you want to add some cinnamon to your diet. Well, all of you should, and you should get off your drugs. All right, now this is cinnamon and its health benefits. It's an anticoagulant to help with blood disorders. Did y'all know it's actually an ingredient inside of my new foreign protein cleanse? It's the fourth ingredient of all of them in my product, cinnamon cassia, which we showed you earlier. Now, this is the second ingredient inside of foreign protein cleanse. It's called organic licorice root. Now, at the right of the screen, you can see there's a study that's titled Inhibition Blocking of Human Thrombin by the Constituents of Licorice. To inhibit human thrombin means to block blood clotting effects of thrombin. Thrombin is the substance in your blood that causes blood clotting. Licorice root, the substance called glycyrrhizin acid in licorice, prevents blood clotting. And I showed you here, thrombin inhibition therapy is a practical strategy to reduce thrombotic and cardiovascular risks via blocking the formation of blood clots. This study aimed to identify naturally occurring thrombin inhibitors from licorice root, one of the most popular edible herbs, as well as to investigate their inhibitory mechanisms. Among all tested licorice constituents, lycocalcone A was found as the most efficient agent against human thrombin in the body, the blood clotting factor. Now, inside of foreign protein cleanse, another ingredient is turmeric. I already showed you the study on the medical news website that turmeric could be used as an anticoagulant. There's all these blood thinning drugs they're giving you and prescribing you around the world. You don't need them. There's plenty of herbs, minerals, and vitamins that'll do it. So in foreign protein cleanse that I'm holding right here, foreign protein cleanse, we put turmeric in there. And at the right, you'll see from November of 2023, just 5 months ago, they titled this article, The Connection Between Turmeric and Fighting Off Blood Clots. They write in this article that when it comes to fighting off blood clots, turmeric is a powerful ally. The compound curcumin found in turmeric has been shown to have antiplatelet and anticoagulant properties, meaning it can help prevent the formation of blood clots and inhibit their growth. By reducing the stickiness of blood platelets and preventing excessive clotting, turmeric may play a crucial role in maintaining healthy blood flow. Did you also know it's been shown to lower cholesterol levels, reduce blood pressure, and improve overall heart health? These factors, they continue, are crucial in preventing the development of blood clots as they contribute to the proper flow of blood through the blood vessels. Incorporating turmeric into your daily diet is a simple and effective way to harness its potential in fighting off blood clots. This is from bloodclot.org. Oh, these medical professionals are all about blood clots. Foreign protein cleanse has 4 ingredients inside of it that actually dissolve and remove blood clots. That's why it's in there. Why? Because COVID-19 was causing blood clotting. Here's foreign protein cleanse. You get 1 bottle for $46, or you get 6 for 5% off each one of those bottles. Anyway, this is a great option. Now, we're going to continue here. We got about 4 more minutes. I'm going to fly through these. There is a product called N-acetylcysteine. Looking at the screen, there's a titled article, N-acetylcysteine prevents occlusive arterial thrombosis. Thrombosis means blood clots. And it states in the title, N-acetylcysteine prevents blood clots in a dose-dependent manner. The more N-acetylcysteine you take, the more blood clots you bust up. All right, so in conclusion, in their study, they write, N-acetylcysteine, which is at thedrardisshow.com, reduces the rate of platelet clotting and increases the time to form occlusion or a blood clot with concentrations between 3 millimoles and 10 millimeters. At 10 millimeters or millimoles, NAC, N-acetylcysteine, completely prevented platelet aggregation. There is a dose of NAC that completely prevents blood clots. Has your cardiologist told you that? He should have. Here's N-acetylcysteine at our website, $34.99. Go get it. All right. These are just solutions for you guys. You don't have to do them all, but you might want to start talking to your doctor or do your own research or watch this presentation over and over and over and decide what's going to be right for you. All right. Now, I have one product at thedrardisshow.com. And the next 4 ingredients I'm going to go through in research studies that prevent blood clotting, blood disorders, all 4 of them are in that one product. which makes this very easy. You got Foreign Protein Cleanse with several of these products you could do every day, 2 dropperfuls every single day. You've got EDTA you would do once a day, 1 dropperful every day, first thing in the morning. I would not do your Foreign Protein Cleanse right after that. I would wait and do Foreign Protein Cleanse a couple hours after doing EDTA. So EDTA by itself in the morning, if you're going to use that, 1 dropperful in the mouth. Foreign Protein Cleanse, 2 dropperfuls every day, lunch and dinner. And then this product here is called Cardio Flow at the Dr. Ardis Show. Now, the first ingredient I'm going to discuss here is the very first ingredient in my Cardio Flow product. It's called Google Resin Extract. The title of this article from Asian Journal of Pharmaceutical and Health Sciences reads, Google, an excellent herbal panacea, I highlighted it in blue, prevents platelet aggregation and breaks up already formed blood clots. Wow. Google Resin Extract does that. That's why it's in my Cardio Flow. You'll see it highlighted on the screen in the supplement facts panel. There's 300 milligrams of Google Extract in my Cardio Flow product. Now, bromelain is the next product they mentioned. Bromelain influences blood clotting by increasing serum fibrinolytic activity and by inhibiting the synthesis of fibrin, a protein involved in blood clotting. In rats, the reduction of serum fibrinogen level by bromelain is dose dependent. The more bromelain you take, the better. The actual definition of fibrinolysis is on the screen. This is how the body produces blood clots. And bromelain actually reverses that. Well, bromelain is the second ingredient in my Cardio Flow product. Then cilantro. Did y'all know they say cilantro is bad for you? Can I show you why it is they say cilantro is bad for you? Look at number 4. They say the 4th reason why cilantro is bad for you is because cilantro can slow down or stop blood clotting. Nobody wants blood clots, people. Cilantro is good for you. It stops you from blood clotting. Guess what? Cilantro is inside our product. In fact, I didn't move the little red screen, but right above Butcher's Broom on the screen is cilantro leaf powder. Butcher's Broom is the last one here. What is Butcher's Broom good for? You see it on the screen. Oh, it's good for poor blood circulation, such as leg cramps or swelling and varicose veins. It's in there. I just happened to reverse these two. Cilantro leaf and Butcher's Broom. These are 2 ingredients inside the Cardio Flow, and you'll see on the screen highlighted. 4 ingredients in Cardio Flow. Google Extract, bromelain, cilantro, and Butcher's Broom, all of which combined help make up the formula I created to prevent blood clotting and improve cardiovascular function. Bleeding disorders does not have to be an end-all to be-all. Get Cardio Flow today at drardisshow.com. I am Dr. Ardis. This is Blood and Bleeding Disorders 101. I'm going to stop the sharing, and I want to tell you something. I love you. I'm grateful for you. I hope you have a great week. And if you have any questions, please write them into info@thedrdisshow.com. And our team of people are working very well. We have a new customer service manager. There's lots of rumors that while I was off trying to protect people during COVID, that there wasn't quick enough responses, and we were really lame on our getting back to people. We have a whole team of people helping us do that now. We're so excited about that. We've been able to get those organized. Anyway, God bless you. We love you, and we're going to see you next week.